I'm joined by Dr Eldré Beukes from the Anglia Ruskin University, and her paper on the effects of Covid-19 on the tinnitus community has just been published. So Eldré, what does this study actually tell us?
Yes, Nic, I think this study's three really important implications. First of all, that contracting the COVID virus can lead to tinnitus and hearing loss. And I think more and more of these reports are coming out, and the research that Kevin Monroe's done has also shown that. And so it's important to monitor that and to be aware of this. The second finding is that if you've had the COVID virus and you had tinnitus before having the COVID virus, that your tinnitus may become worse. So lots of people also mentioned that after the virus, they really noticed an increase in the bothersomeness or the loudness of their tinnitus. And the third finding is, even if you haven't had COVID, the effects of the pandemic, the greater effects, can also have an impact on tinnitus experiences. So lots of people are experiencing that their tinnitus is worse due to all the factors surrounding the pandemic, all the stress and the worry. So the wider pandemic is impacting on tinnitus experiences.
Okay, so you mentioned that there could be some factors at play here with people who haven't had COVID but are experiencing bothersome tinnitus or more bothersome tinnitus. What do you think some of those factors could be? What were reported in the study?
I think it was really interesting, and it just showed the variability that we see in the tinnitus population, that both external factors, so things going around people, and internal factors are influencing these experiences. So internally, the increased stress and worry and anxiety, and the sleep that's been affected. Lots of people mentioned their sleeping affected. So all those factors did significantly cause tinnitus to be exacerbated. And then external factors, things like people feeling more lonely during the pandemic, missing social interactions, and not having the normal routines they normally have, also seem to impact. And even things like there were significant differences between those that found that they weren't able to exercise as they used to before. So I think that quality of life, those elements also seem to play a role.
Mm-hmm. The paper was a global study and it looked at people in different parts of the world. People in the UK seem to have tinnitus that was more affected by the pandemic than people in other parts of the world. Why do you think that was?
That was really an interesting finding to me. And every time I looked at which country seemed to be, which location was most affected, it was the UK. And I did try to look up at other studies, and there are lots of studies out there saying mental health is affected during the pandemic, but most of the studies I could find are looking at a population in one country. And there are lots of those studies, but there are very few studies, even the systematic reviews, they're reviewing different countries, but there are very few studies that have looked globally. So it is very hard to compare. So I'm glad we could compare and see these findings. And I think that there probably are lots of factors, partly to do with the timing of the study. So as we know, the virus had peaks at different places, and it did peak in Europe before it peaked in the UK, and it only peaked in the USA afterwards. So I think when we're doing the study was probably mostly at the peak in the UK, and that peak had passed in Europe, and the USA weren't quite aware of what was still coming possibly at that stage. And just from the comments I got, I think the people in the UK did find it a really sudden change, going from life as normal to suddenly having this lockdown, suddenly having to change to working from home. And I think there were lots of comments of really missing the social interactions. So I think they found that really hard, only being able to go out once a day, not really meant to be speaking to other people or interacting with other people. So I think those kind of factors, but definitely, we definitely need more of these comparisons to be sure of why the UK had such, more significant experiences.
And another group that seemed to be more affected were actually younger people and women. And tinnitus is generally regarded as something that will affect older people, but this kind of turned that around a bit. Do you think that was similar factors to the ones you've mentioned about the UK?
Yeah, so what I did with those is, so that's what the stats showed. And then there was opportunity for people to give free text responses to qualify why they said what they said. And what I could sort of interpret from that is I think lots of the women did feel overwhelmed. Lots of them mentioned having to homeschool, having to work from home, having no one to ask about their work at home, having more house chores, having to make more meals. So I think maybe lots of those responsibilities fell on women, and they just felt overwhelmed, or there were lots of those comments mentioned by women. And I think for the older people, some of them have been retired, they are at home more, so that lifestyle change might not have been as much as for younger people who might have been at a workplace and having a bigger change of not seeing people at work, not having those daily interactions, having to adjust to working from home, having, to adjust with having children at home, and also juggling more things possibly.
Yeah. So I guess there are implications in these findings for the health services, particularly in audiology and mental health services.
I think these studies are important, and possibly the whole pandemic, one thing that people might realize more is hearing related problems. I find myself constantly, strangers asking me something with a mask on, and I just can't always follow what they're saying. So these aspects are important in life, and hearing and tinnitus are, and hopefully it's gonna show the more global population that. But for the health service, being aware that COVID and having the COVID virus could cause tinnitus and hearing loss is really important. It's important that health professionals ask those questions and then support people. I think people feel isolated, so the emails I've received, I think everyone thinks it's a one-off, and it seems that as though it isn't. And for health services also to be aware that there might be more people that are bothered by their tinnitus. There has been one study in Italy that said since their clinic opened, they've had more people come back to them with tinnitus, just saying they're really not coping with their tinnitus anymore. So we might expect greater demand. And I think also viewing patients more globally, knowing which factors can really influence tinnitus and picking out which of those factors came to play with each individual and seeing what we can put into place to address that. People might not always link the connection that, the added stress is related to the tinnitus increasing. So helping them identify those links and putting things in place to address the external and internal factors that are causing this tinnitus to become worse.
So COVID's obviously going to be ongoing and with us for a little bit longer. So what's next for you and this research?
So there's been a few things I've been looking at. One is from the study, although for about a third of the people tinnitus was worse, there was a whole group where tinnitus was unchanged and a very small percentage where tinnitus was actually better during the pandemic. And that's also really important. What has made those people cope better during the pandemic? So I've been looking at what resources those people drew on to cope with their tinnitus during the pandemic and what helped them, because I think that also informs our management of tinnitus. And interestingly, from that is that social support was one of the main things that helped them cope with their tinnitus during the pandemic so far. Relaxation, meditation, and exercise. So those are things we are putting in our tinnitus clinics. Lots of tinnitus clinics do relaxation, and so it's just emphasizing that importance and putting more research backing behind that. But I think looking at it from a different perspective, just to inform clinical practice, is what I've been doing. And because it's such a big sample, also looking at further patterns, if there are subgroups of people in this population, because we've got all this data.
That sounds really exciting, and I look forward to reading the next paper. The current paper is available. The link is in a slide at the end of this video, and it's freely available as open access. Thank you very much, Eldré, for your time today. It's been great talking to you, and I look forward to talking to you again in the future.
Lovely speaking to you as well. Thank you.